Asthma is an inflammatory disease of the lungs. The inflammation in the lungs is the same kind of inflammation you get when you cut your skin. The redness you see around the cut is the same type of inflammation that occurs in the lungs of people with asthma. Just like the scar tissue you see after the cut in your skin heals, ongoing inflammation in the lungs also causes scar tissue to be formed. Fortunately, scar tissue in the lungs doesn't form as fast as it does in the skin, but as long as the inflammation in the lungs isn't adequately treated, scar tissue will continue to form. You can think of asthma like a fire in the lungs and the scar tissue as ash. As long as the inflammation continues to burn fiercely, scar tissue is formed fairly quickly. The medications we use to treat the inflammation of asthma reduce the flames of the inflammation to a slow smolder. This reduces the amount of scar tissue that is generated in the lungs. The effects of this scar tissue can be seen in the change in lung function over time. Normal adults lose about 1 to 2% of their lung function per year after lung function reaches its peak at about age 20. However, lung function declines more rapidly in people with asthma, particularly if they don't keep it under good control. Recently, a study was undertaken using MRI to examine the effects of this inflammation in the lungs. As one would expect, the lungs inflated evenly in patients without asthma. However, even in a mild asthmatic whose lung function was measured as normal, there already were some areas of the lungs that did not receive as much air during inhalation as they should have. This effect was much more pronounced in an individual with relatively normal lung function, but who had symptoms consistent with moderate asthma. Lastly, this was obviously much worse in a patient whose lung function was only a third of what it should be due to his severe asthma. Lastly, the lung inflammation in asthma results in enough scar tissue formation to limit the treatment of asthma. In a study of 105 patients who presented to an allergy clinic and were diagnosed with asthma, a questionnaire was used to estimate the length of time the patients had had asthma symptoms before seeking treatment for it. Patients who promptly saw their doctor within 6 months of developing asthma symptoms saw an average of a 27% improvement in lung function after being treated with an inhaled steroid for 2 years. Unfortunately, the longer the patients waited before seeking treatment, the less improvement there was in lung function. Patients who had had their asthma symptoms for as long as 10 years before getting it treated had only about a 7% increase in lung function, only a quarter of the improvement they might have had they promptly sought treatment for their symptoms. The mainstay of asthma treatment, after minimizing your exposure to the allergens to which you are allergic, is the anti-inflammatory steroids in an inhaled form. Inhaling the steroid directly into the lungs vastly decreases the total body exposure to steroids, thereby dramatically reducing the chance of side effects. Rescue treatment, which is the use of the short-acting, lung-opening medications like albuterol, works very quickly to relieve any symptoms you're having, but does nothing for the underlying inflammation in the lungs. In fact, several studies have shown that when symptoms are severe and are heavily treated with albuterol, the use of albuterol can actually cover up the inflammation in asthma, making asthma seem like it isn't as severe as it really is. When people use just their albuterol, the inflammation can worsen without the patient realizing it until it gets so bad that it causes a hospitalization or death due to an asthma attack. This study shows that the risk of hospitalization increases for patients using more than 5 albuterol canisters per year until they are about 4.5 times more likely to get hospitalized for asthma if they are using 8 or more prescriptions of albuterol per year. Conversely, the use of anti-inflammatory steroids for asthma significantly decreases the risk of hospitalization, so that asthmatics are almost 4 times less likely to be hospitalized even if they refill their monthly prescription only 2 or 3 times per year. Unfortunately, that doesn't mean that we can save money by buying an inhaled steroid canister every 4 or 5 months. A long-term study of asthma death rates showed that the rate continues to decline the more the steroids are used. Asthmatics who don't use inhaled steroids are 15 times more likely to die from asthma, as are patients who use their inhaled steroid daily and go through 12 canisters per year. To summarize the take-home messages, asthma means inflammation in the lungs, which leads to scar tissue. Inhaled steroids reduce the lung inflammation, making asthma less severe, resulting in fewer hospitalizations and decreased risk of death due to asthma. Earlier treatment leads to better improvement in lung function. These are the reasons why I aggressively check lung function, even in people who have no symptoms but have some wheezing during a respiratory infection that gets treated with albuterol. Lung function tests may reveal that there may be more inflammation in the lungs than the patients are aware of, and future problems with the lungs might be avoided by treating them early on with inhaled steroids.